Okay. Good morning, everyone. My name is Duncan Boro, and my speech today, I'm gonna talk of how dementia affect the brain and daily life. So, imagine waking up one morning and not remembering where you are, what day it is, or even the name of someone you have known for many years. For millions of people living with dementia, memory loss and confusion can become part of everyday life. Most of us know an older adult such as grandparents, family members, friends, or neighbors. Such people live longer. There is a great chance that we may know someone who is affected by dementia. I chose this topic because I work as a CNA and a medtech in a memory care. So, caring for older adults, including people living with dementia, through my work, I have seen how dementia can affect person memory, communication, behavior, and ability to complete everyday um, activities. After listening to my speech, you will be able to explain what dementia is, identifies some ways dementia affects daily life, and describe communication technique uses when caring of people living with dementia. Today I will discuss the main point. First, what dementia is and how it affects the brain. Second, how dementia affect a person's daily life. And third, communication techniques used when caring for people living with dementia. First, what is dementia? According to the Centers of Diseases Control or Prevention, also known as CDC, dementia is generally term used to describe problems with memory, thinking, and decision making that interfere with everyday activities. So, dementia is not one specific disease, and it's not considered as a normal part of aging. There's a different type of dementia, but Alzheimer's disease is the most common. So dementia develop when brain cells become damaged. This damage can interfere with the ability of brain cells and communication with each other. Different areas of the brain control different abilities, including memory, communication, and judgment, movement, and behaviors. Because this dementia can affect people's different depend on which area of the brain are. I'm gonna show you an image of Alzheimer's brain and a normal brain. This is a normal brain, and this is the Alzheimer's brain. So as you can see on the photos that I just showed you, the difference between the two brain, Alzheimer's disease and the normal, which it's not damaged. uh, so now that we understand what dementia is and how it affects the brain, let's look at how dementia can affect a person's everyday life. According to the National Institute on Aging, people living with dementia may experience memory loss, confusion, communication difficult, and problem completing everyday activity. During the early stages of dementia, a person may forget appointments, lose personal belonging, repeat the same question, or have different remembering recent events. Such as dementia progresses, the person may need more assistance with their daily activity. For example, a person um, a person may need help preparing meals, managing medication, choosing appropriate clothing, bathing, or finding their way around their familiar places. Dementia can also affect person emotion and behaviors. Some people may experience anxiety, agitation, wandering, difficult sleeping, or change in personalities. That is, in my experience working as a CNA and a medtech, I have seen how dementia affect people differently. One resident may ask the same question many times because they do not remember asking it before. Another resident may become confused about where they are and believe they need to be going home, even though they are already in their places where they live. Sometimes a person may become frustrated or upset because they are having difficult communicating what they need. Um, this experience have taught me that dementia affects so much people and their memory. So if it can affect a person's independence, communication, emotion, relationship, and ability to complete everyday activity. Because dementia affect memory and communication, caregivers often need to change the way they communicate with people living with dementia. This brings me to my third main point: communication. According to the Alzheimer's disease association, caregivers should approach the person calmly. Calmly, maintain eye contact, and speak clearly and use simple words and sentences. Ask one question at a time, make communication easier. I'm going to give you an example. For example, instead of asking a person several questions at once, a caregiver can also simply simplify a question and give the person enough time to respond. It is important not to rush the person. People living with dementia may need additional time and understanding the information and communicate their need. Nonverbal communication is also important. Facial expression, body language, gestures, and tone voice can communicate feeling even when a person has difficult speaking. Caregivers should also caregivers should also urge with an embracing a person who is confused. For example, if a person living with dementia says they need to go home, even though they are already at home, urge them with you can tell them urge them to with many increases their confusion or frustration. You instead of the caregivers can remain calm. Instead, a caregiver can remain calm and acknowledge how the person is feeling and redirect their attention to another conversation or activity so that they will forget about the way they wanted to go home, or so that you can make them feel comfortable and know they're in the right place. So good communication can help reduce frustration uh, and help the person feel safer and more comfortable. Now that I have explained what dementia is, how it affects daily life, and importance of communication, let's review the three main points of my speech. First, Dementia affect the brain and can cause problem with memory, thinking, communication, and behavior. Second, dementia can affect a person's independence and their ability to complete everyday activity. And third, clearly, calm and respect communication is an important part of caring for people living with dementia. So, why is this information important? This is because dementia affect millions of people and their families. Even if we do not work in healthcare, we may have family members, friends, neighbors, or someone in our community who develop dementia. Understanding dementia can help us better understand what people living with conditions expect or experience and communicate with them with greater patience and respect. A person living with dementia may forget name, places, and event, but they still deserve to be treated with dignity, patience, and respect. Understanding dementia help us use the person behind the condition um, with respect and acknowledgement. So that will be the end of my speech. Thank you all for listening.